Hello, everybody. I am Idrita Joyanson, and I'm presenting today on behalf of Team Viola. And we worked on the Medi which is a national electronic health recording and health record system. So let's meet my team members. We have Mr. Kima Tiamenyo, who is our product manager, Miss Agnes Nikuya, UI designer, myself, Edith Youngson, who I'm the data analyst, Mr. Joseph Uzbana, UX researcher, and then Mr. Randolph Inshuraba Aintree, who is our project manager. And before we dive into our system for today, I want us to imagine two different scenarios. One is a scenario where we have a patient coming in from anywhere else in the country, and this patient comes in unconscious, and doctors have to attend to this patient without any prior notice or any access to the patient's previous health history to know what drugs the patient is on or even what health conditions the patient already has. Then let's also imagine another scenario where a patient comes in unconscious, but then with just a single fingerprint, we are able to access the patient's data, health history, medications that the patient is currently on to be able to properly give the patient the treatment the patient needs. Now that we have this in mind, this is what our MediTrack is about. Now we realize that in Ghana, healthcare delivery across urban and rural areas is greatly hampered because of the lack of integrated, accessible electronic health records. And approximately 60% of facilities still use paper-based or fragmented electronic systems, which results not only in delays in diagnosis and increased errors, but also increases higher costs and poorer patient outcomes, particularly in the underserved populations in Ghana. So our GCGO was healthcare. And then let's come to our user persona. We have Dr. Youngson, who's a healthcare worker and works in a rural clinic. What are these the user persona's pain points? There is reliance on paper-based and fragmented electronic health records, and there are manual tasks which are done and take up significant time. Also, there are delays and difficulties in assessing the patient's histories. What do these intend lead to? There is increased potential errors in treatment, there is frustration and daily struggle with the system, and the inability to provide timely informed care, particularly for the underserved community. What do statistics show in recent times? So as we can see, a lot of developed countries have already adopted electronic health records. But then in countries, the developing ones like Ghana, there is a lag due to because you are behind in infrastructure and training gaps. So the government of Ghana currently is doing something about it to increase electronic health records. And that is why we thought of this idea, and that is why we brought this in our MediTrack system. So per our statistics, we realized that in Ghana, paper-based is still about 60% used in facilities. All the electronic health records is not so used, as we have just about 40% of health facilities using the electronic health records, right? And then someone would ask, why should we move from our paper-based to the electronic health records? Statistics also show that there are lots of things we gain from using the electronic health records, where we have increased access to critical information, there's an increase in preventive care adherence, there's a decrease in the hospital readmissions, chronic diseases are managed properly, and there's a decrease when it comes to medication errors. Now, why this solution? What is our MediTrack all about? What is our MediTrack going to do for us? What makes our MediTrack different from others out there already in the system? So our MediTrack is not just based or it's not just used for facilities, but it incorporates nationwide electronic health records, such that no matter where you are in this country, whether you live in Sunyani and you've now moved to Bolga, or whether you live in Accra and you've now moved to Navongo, you are going to be able to access your health records. The facility you visit, no matter what facility you visit, the health professional is going to be able to view your health records from previous years to be able to give you proper advanced care tailored just for you. So it enables health centers and patients to access records. And the amazing thing is, it's not just with you using a card, but rather we use both biometric and PIN authentication. So what does our solution provide? It centralizes patient data for accurate and continuous care. It's supported by workforce training, infrastructure investment, and robust data privacy policies so that patients know their data is intact. And then likely effective due to its interoperability and secure user-friendly access methods. Let's give you a preview or a peek view into what MediTrack is supposed to look like. So when we come to our landing page, we see where you can register or you can log in using either your biometric or your PIN. So for your biometric, all we need is just a thumbprint, a fingerprint, and we are good to go. And then if you want to use your PIN, your full name, and then the PIN that you use, and then you're also good to go. The third one, this gives you a sort of a free access or a preview, sorry, into what it looks like when health professionals log in. So the health professional can see as how many patients the person has treated in the day, the active cases, and then can also view the patients, the appointments, vitals monitor, and then can also forward things to the lab. So moving on, what were some of the user pain points in testing? So users reported that there should be a need for smooth migration of existing patient data from older EHR systems to the national EHR. And then feedback included requests for a more vibrant UI and additional security features like a PIN setup, which was initially not included in the wireframe. So recommendations from feedback reports include incorporating patient data migration tools for seamless transition, enhancing UI design with eye-catching colors for better usability, adding PIN security setup functionality to complement biometric access, and updating the name field so we capture not just the last names but also the middle names. Okay, now if our product or if our app SS is supposed to get funding, what is going to happen? First of all, we are going to expand our prototype into a fully functional cloud-hosted EHR system that can be accessed nationwide. Also, we are going to conduct extensive user training workshops to ensure widespread adoption so that almost every hospital in Ghana is able to use it, no matter which people are operating it. And then we're also going to deploy infrastructure upgrades to support nationwide internet connectivity and system uptime targets. And then guess what? Even for people who live in rural areas where internet connectivity is not the best, we're going to develop offline data entry capabilities for remote areas with poor connectivity so that even when they access the app, when network is poor, once network is restored, everything will be updated and then we'll have a smooth running system. I know I've spoken a lot, but then I want to remind us again, why MediTrack? What is MediTrack supposed to do for you? Just a little reminder of what we are here for. So MediTrack is supposed to improve EHR integration in Ghana, and it is vital to reduce healthcare delays, errors, and costs. And ultimately, it will save lives and improve quality healthcare. Our solution also provides equitable access to reliable, secure patient data that empowers healthcare workers and patients alike to achieve better health outcomes across both urban and rural settings. So MediCheck is an innovation that actually currently meets a need right here in Ghana. Thank you very much for attention. Once again, I'm Edith Joyangs, the data analyst for Team Voila, and here is our presentation. Thank you.